Welcome back to another episode of The Radio Psychs, your premier podcast for insights into everything mental health. I'm Dr. Aaron Haddock.
And I'm Dr. Rhonda Yu. We're psychologists who care about people and bringing science to practice.
And we're so glad to have you join us.
Please note that the information shared in this episode is solely intended for informational and entertainment purposes only and is not a substitute for professional medical or mental health advice, diagnosis, or treatment. Today's topic is headaches, migraines, and your mental health.
Sorry I had to reschedule this recording session to today, Rhonda. I had this really bad headache and just wasn't able to do it yesterday.
Oh, you don't have to be sorry, man. I get it.
Do you get headaches?
Yeah, and more often than I'd like. In fact, I had one this morning that lasted until sometime in the afternoon.
They're so common, aren't they?
Almost everyone has a headache occasionally, but when they happen repeatedly, they're a symptom of a headache disorder. And according to the World Health Organization, it's a global problem that affects about 40% of the population.
And they tend to be more common in women.
Right.
Now, headache disorders include several different types. The most common is the tension type headache, which often involve muscle tension and contraction in the head and neck, leading to a dull, achy sensation.
Yeah, that's one I usually get.
I'm not surprised. Tension type headaches affect over a third of men.
And for women?
Over half. And for some, it happens very frequently. For about 5% of the population, headaches occur daily. They can stem from factors like stress, poor posture, or even eye strain, and they're often accompanied by feelings of pressure or tightness in the head.
And then there's the migraines, severe headaches that cause throbbing and pulsing head pain on one side of the head. They're a whole different ballgame and involve abnormal brain activity in the areas responsible for pain processing and sensory perception.
About a third of people who have migraines have them with auras, which are sensory disturbances that set in slowly over 5 to 20 minutes.
Yeah, they're usually visual. So the person might see, for example, flashes of light, zigzag lines, or blind spots, which often signals that a headache is coming sometime within the next minutes to an hour.
During a migraine attack, there's a cascade of neurochemical changes in the brain, including the release of neurotransmitters like serotonin and CGRP, which can lead to the dilation of blood vessels and the initiation of pain signals.
The trigeminal nerve, the largest of the cranial nerves, plays an important role too. During a migraine attack, it becomes sensitized, amplifying pain signals and contributing to the throbbing, pulsating sensation that you get from a migraine.
Unfortunately, migraines are common, affecting at least 1 in 7 adults.
And is 3 times more common in women than men, a difference that appears to be hormonally driven.
It mostly affects people in the 35 to 45 years old range, but can affect much younger people.
Including children, which isn't often recognized.
Yeah, a lot of people don't realize this, but recurring migraines affect as many as 1 in 10 children and adolescents overall.
Now, what about cluster headaches?
Well, these are frequent, brief, but really intense headaches, which is why they're often referred to as suicide headaches that are usually focused in or around one eye.
Right. People who get these often describe them as a stabbing or piercing pain around one eye or temple.
It's relatively uncommon, affecting less than 1 in 1,000. And unlike the others, where it's more prevalent in women, cluster headaches affect 6 times as many men than women. We don't know the exact cause, but researchers believe they may involve abnormalities in the hypothalamus, a region of the brain that regulates sleep-wake cycles and other vital functions.
And last but not least, we have medication overuse headaches, also known as rebound headaches, which are caused by chronic and excessive use of medication to treat headaches, including over-the-counter painkillers and prescription medications. This one affects an estimated 1 to 2% of the general population.
It's a vicious cycle. Imagine taking medications for relief, only to then experience a vicious cycle of rebound headaches, perpetuating the very problem they were intended to alleviate.
It can be a really difficult situation to be in. People experiencing these headaches can feel trapped in a cycle of pain and medication dependence.
So, what does the research say about the relationship between headache disorders and your mental health?
Well, simply put, They don't help. Headaches aren't just physical discomforts, they can take a significant toll on your emotional well being. Studies have shown a strong association between headache disorders and various mental health conditions, including anxiety, depression, and even suicidal ideation.
Hmm. Anxiety is actually the most common mental health problem associated with migraines.
hmm
Studies indicate anxiety disorders are twice as prevalent among people affected by migraines compared to depressive disorders.
Well, those with depression are over 3 times more likely to develop migraines compared to those who are migraine free. And conversely, those experiencing migraines are almost 6 times more likely to develop depression.
Hmm. There's a study published in 2019 in Frontiers of Neurology where researchers found that nearly half of their participants who experienced chronic migraines with auras reported suicidal ideation, compared to only about 3% of those who were migraine free. And those who experienced chronic migraines were also found to be nearly 6 times more likely to have attempted suicide.
So, how do we manage headache disorders?
Let's start with lifestyle modifications. While they may seem simple, they can make a significant difference in preventing and managing headaches.
Things like maintaining a regular sleep schedule, staying hydrated, eating balanced meals, and managing stress through relaxation techniques or mindfulness can all play a role in reducing headache frequency and severity.
Definitely. These lifestyle changes form the foundation of headache management, providing a solid framework for building resilience against headache triggers. But what's there to do when lifestyle modifications aren't enough?
Well, there are psychological interventions. They play an important role in headache management.
Let's start with relaxation training.
This is a widely used approach for managing tension type headaches and migraines. It involves teaching people various methods to induce a state of relaxation in the mind and body. The techniques used typically include progressive muscle relaxation, deep breathing exercises, guided imagery, and mindfulness meditation.
Cognitive behavioral therapy is another effective intervention for headache management. It helps people identify and modify maladaptive thoughts and behaviors related to pain, empowering them to develop healthier coping strategies and improve pain management skills.
Lastly, there's biofeedback, a technique that involves the use of electronic monitoring devices to provide people with real time information about their physiological processes, like heart rate, muscle tension, or skin temperature, to teach them how to control and modify them voluntarily.
Decades of research demonstrate these interventions to be effective for reducing the frequency and severity of headaches.
Now, let's talk about our pharmacological options. While lifestyle changes and psychological interventions are essential components of headache management, medications can also play a vital role in alleviating symptoms.
For acute relief, over the counter pain relievers like acetaminophen, ibuprofen, or aspirin are commonly used. However, it's crucial to use these medications judiciously to avoid medication overuse headaches.
For more severe or frequent headaches, prescription medications may be necessary. Triptans are a class of medications specifically designed to target migraines, while preventive medications such as beta blockers, antidepressants, or anticonvulsants may be prescribed for long term management.
Before we wrap up, we want to make it clear that it's important to seek guidance when considering any treatment options for managing headaches, whether it's making lifestyle changes, exploring psychological interventions, or considering pharmacological options. Consulting with a qualified professional is key.
And that's our time. We hope our discussion has left you feeling mentally fortified and headache free, or at least armed with some insights that may be of help to you or others experiencing headaches.
Until next time, take care and be well, everybody.
Take care and be well.